Dr. Zhao cured a lady with severe bowel obstruction, which makes her very ill. The obstruction happened in her right ileosacral valve. Hello, my friends. Today I'm going to tell you another my treatment story. A lady around 80 years old and came in and for help. So she had a painful stomach and felt sick, felt want to vomit, and also cannot eat, and also cannot passing stools or cannot even passing wind. So previously, so after I give the treatment and she tell me the story about her illness history. So long time ago, probably around 12 years ago, she had appendix bursitis, and appendix become burst pus, and the pus cannot come out. So you know why the pus can come out, you guess. So eventually she said the pus come out from her vagina. So I feel so sorry for her. Of course, this is a tragedy. And later on, she had the keyhole surgery and removed the appendix. And then since then, I think she always have a weak bowel problem. And why the pus can come out from the vagina if the man will be worse? And because the woman, they have an ovary, and alongside the ovary, there's opened two tubes which can catch the egg and then take them to inside of a womb, womb, and then get pregnant. So that one also catch the pus and then take in and then discharged from the vagina. So that's why the pus can come out from her vagina. So we just understand the body is amazing. Okay, so sometimes they can do the things help our body survive. Okay, so this time she ill and then have a very blockaded bowel, and it's ileum-celiac area valve blocked. Why? Because her pains only concentrate on the right side, and at the same time she had the pain on the back, on the low back, on the right side as well. And even she had a left hip problem, and she said is waiting for a hip replacement. Today I read the result, said the hip joint cartilage is badly damaged, and also some part is missing and have a calcified joint as well. Okay, so that moment, the urgent thing is let her bowel moving. Okay, so what I did is treat the nerves, treat the sacrum ilium, as well as she said the neck painful. So I did the neck treatment, and it's on the same side, right side, and did the neck treatment, and also moved the low back sacrum ilium joint area. And because that area have nerves control the ileum-celiac valve, and then after maybe 20-30 minutes treatment, and you know what, she had a big wind. Oh, and she said, embarrassed. I said, not at all. And the doctor's purpose is help you to stop the pain, stop the blockage. Okay, it's a colon blockage or colon obstruction problem. So, and then I treated another week, because I treat her weekly, right, weekly, and another day or week, probably, another week, I think, another week, and then she feels a little bit better, but she still said I'm lethargic and I'm still have some pain, but she started eating, and I did the same treatment and let her did the exercise, and let her do the exercise and home, also move the nerves, move the spine, especially the lower side, and like the sacrum ilium area. And then also did acupuncture, did some heating on the bowel. So third time she feels a little bit better, but she missed the fourth time. And then because she had an opportunity to go to the hospital to check up. And then went to the hospital, the doctor checked, they didn't find anything. He said it just, we cannot find anything, right? So send her home. And then she came again. I said, okay, maybe hospital take it. But she came again. And I did continue this fourth treatment, fifth treatment, and the sixth treatment, she's fine. All her bowel problem is gone. Okay, so I record all the footage. Each time she, after she had the treatment, I let her talk about the. When doctor treats a patient, he always check where the nerves come from, and then he will check the nerves blockage, and treat the blockage. Then the target problem will be easily be treated. So this patient have the blockage on the right corner of the colon, which is from the small intestine and join the large intestine. And the iliac sacral valve blocked because the nerves. So the nerves can come from partly from the vagus nerves, which is the head, from the neck area, and also can come from the sacrum ilium joint area. This area can block the nerves, mainly right or left corner of the large intestine, and also the small intestine joins the large intestine, this area. So we treat the neck and the lower back and make people do exercise on the lower back area, and then the problem can be solved out. Okay, keep going. Mm-hmm. Okay, and then now swing your leg, bring your leg up, yeah, up, swing your leg left, right, yeah, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 14, 15, 16, 18, 19, 20, 22, 23, 24, 26, 27, 28, 30. And roll your whole back, roll, slowly, roll, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, right. And then bring your leg down. Okay, relax. What happened these 3 days?
I felt nauseous, my stomach felt tight, and I had no appetite, and I felt really poorly.
Poorly, yeah.
Very lethargic, not able to do much.
Yeah. And also plus this hip pain.
All because of this hip pain, and I felt it in my neck as well.
Uncomfortable, yeah.
Very uncomfortable, and
Okay.
So slight nausea again now.
Yeah, you slightly feel nausea
A
again.
bit nausea again now.
Okay,
Yes,
right.
Yeah.
Okay, right, but your nose is generally feeling better.
I'm hoping so.
Yeah, okay,
hoping so.
right, okay, right. You. Okay, hi, Anne.
Yeah,
So this is your second visit.
Yes.
And last time you said, oh, tired, you didn't eat food, you cannot pass wind,
Yeah.
and you burp a lot, and also with your hip pain a lot, okay?
Yeah.
And you feel sick. I cannot do too much because you said, oh, don't, please gentle to me, isn't it?
Yeah. So you
So
understand that.
today I did a little bit more, all right?
Yeah.
On your back, on here,
Yes.
and to try to help your hip as well.
Yes.
Okay, can you tell the difference between last time and this time, the spiritually, the feeling, the whole health, okay?
I think I feel a little better. I do. I can feel things going on in my tummy, so I think that's a good sign.
Yeah, so you feel your tummy gurgling more.
It still hurts. The top of my left hip still hurts.
Yeah.
So it's still pain there, but
The right hip, yes.
yeah.
Right hip.
Yes, the right hip.
Yeah,
Yes, that's
right
right.
hip.
Yes.
That takes a little bit while, all right?
Yeah.
Because also you have the hip arthritis on both hip, all right? To be
Yes.
honest,
Yeah.
because of the age, me same. If arthritis grow every day, all right? When we get old, we all have arthritis. But the main thing is we can eat.
Yes.
We have to be able passing the food down, all
Yes.
right?
Yeah,
So
absolutely.
that make you more energy, all right?
Yeah.
So you feel a little bit more energy, breathing better.
Early to tail
Yeah,
yet.
yeah.
Yes.
But you feel generally better.
I think I do feel generally better.
Yeah.
Yes,
Okay.
thank you.
Right.
Yeah.
Then the after few. Yeah. Right. Okay. So this is you lie down, rest. This is your fourth or fifth treatment. Visit.
Yeah.
So last few times it's very very painful.
Yeah.
Your back, your hip, your
My
back,
hip. Yeah, my right hip.
and also your colon area.
Yes.
It's very very painful and blocked.
Agony.
Yeah, when I touch here, it's very horrible pain, isn't it?
Yes,
Now I
it was
press
like,
hard.
No, not nearly as bad. It was like a knife
Yeah.
sticking in me. It was really, really bad.
So before you said you have a appendix
Removed. Yes.
bursitis, removed, around 12 or 18 years old.
About 12 years ago.
12 years. You said this is very painful.
Yeah, it is a bit painful, but no,
It's better.
There,
Yeah.
yes,
Yeah.
there.
So this is a stomach 37. It's a point just indicate this part.
Is it really?
Yeah, it is last time I told you I put the needles here. Did you remember?
You did.
I
Yes.
put both needles on
Yeah,
this
you
area.
Did, you
yeah.
did. And
This
that-
this helps the bowel moving, all right?
Yes.
Reduce the inflammation.
It's incredible. I mean, I know they can find lots of things from your feet, but they obviously find lots of things from where you are now, my calf area.
Okay, and then the colon area. This area is much better, isn't it?
Yeah, it is. It's
Now
much
you're
better.
eating better, and then
I'm eating better, I'm feeling better, I'm not in absolute agony.
not actually agony.
Not
And
ag-
also you try to walk.
Yeah.
And last few times you said, I'm lethargic.
Yeah,
I'm
I
exhausted.
know. I didn't
You
even...
cannot eat.
I didn't even recognise Tony coming up. I was in so much pain.
Yeah.
So much pain. I didn't know what to do with myself.
And also you went to hospital and they didn't do anything.
No.
They cannot give you drugs or whatever.
I had no painkillers. No.
No,
I
that's better than painkiller. Painkiller will cause more problem.
Do you think?
Yeah.
Well, I do take paracetamol sometimes.
Yeah, occasionally.
That's okay.
Yeah, that's for the
but not
joint.
ibuprofen.
Also,
No.
last time you said that I take your blood pressure is normal.
Yes.
Only your pulse is 78 or something.
Yeah, that's right, and it still is
Yeah,
now.
that means you have a little bit infection. Okay.
Yeah,
The infection is in your bowel.
Yes.
And this bowel, is a small intestine, large intestine, there's a valve,
Yeah.
and that can leaking the inflammation to this area
Right.
to make the joint pain even.
Yeah.
Even you have no
arthritis on your left.
That's right.
On
my
this is
right,
hip.
on my right
yeah.
side.
And
yeah.
left hip, you said you have arthritis. But you lift your both leg now. One leg by another.
One at a time.
Yeah. You see, you can lift them more
Yeah,
than
yeah.
normal, anybody.
Well,
Okay,
yeah,
down, another one.
And the other one. I mean, I have no trouble. I have no trouble touching my toes.
You shouldn't.
No trouble whatsoever.
You shouldn't do the hip replacement.
I know, but it's
Shouldn't. Otherwise, it causes more problem. All right. You try. Today I try to put the needles here.
Yes. All
And
right.
then make you.
I mean, if
walking
you
back.
could, if you could.
Yeah, because it's hip replacement is big operation.
It is. I know
And
it is.
it
I know.
takes 3 months for you to
Yeah,
learn to walk.
Yeah, I know. It's not easy. No.
Okay, right. Now I start put the needles and hitting
Yeah,
on.
yeah,
Okay.
all right.
Right. Right. 6 weeks ago.
6 weeks ago, I came to see you, and I was in extreme pain. I felt nauseous. I didn't feel very well at all, and I couldn't do anything without feeling really, really poorly. I couldn't
Sick,
do any
yeah.
It was like sitting down, moving a bit, sitting down. I couldn't get comfortable anywhere, in any position. I was just extreme pain.
And you are not eating. Not eating a lot. I mean,
not eating a lot. But,
and a few days you didn't go to toilet even.
That's right. But,
And then
now I'm much better, but I am still on a laxative to make sure that I keep my bowel moving.
Yes.
And I'm going to have a scan for my stomach in early June.
Yeah. Okay. But the whole situation is much changed.
Much changed, much better.
Yeah.
Yes. So thank you.
Okay. Right. Okay. Right. And now you can relax more than before, isn't it? You can get good solid sleep.
I can sleep better.
And also enjoy your bridge.
Yes, I enjoy my bridge. Yes, because I couldn't do any of that 6 weeks ago. I didn't want to do anything at all.
Yeah, okay.
No, I didn't want to do anything, so I'm vastly better than that.
Vastly better. Okay,
Vastly
right.
better.
Okay, you walk, let me see. Good. Before you always are stick. Okay.